Now we're going to look into problems around the elbow and the arm and the wrist and the fingers. I'm going to demonstrate two different kind of diagnoses here. I'm going to demonstrate the epicondylitis and also the carpal tunnel syndrome, what we can do with that. Next to that, you can have a pronator teres syndrome in the elbow, you can have bursitis on the hind side of the olecranion, and you can also have finger ligament distortions, elbow, wrist distortions, and for whatever speaks, you can also have elbow distortion sometimes. But a very common diagnosis is epicondylitis on the lateral or the medial side. On the medial side is called epicondylitis as well. That is then the golfer's elbow we're speaking about, and tennis elbow on the lateral side. Treating this, you use always the solid electrode as well here. And doing this is a treatment. Next to that, we do some eccentric exercise with the muscles. We can do some stretching exercise, and of course we give patients some restrictions in the activity in his daily life if possible. But how does it work, and how do you use it on epicondylitis? First, we always have to place the return electrode. And we always put some cream on the return electrode before we place it. And placing it underneath the body, you can have it handheld, but here's this very nice area to just put it underneath the treatment area. But always if you put it underneath the body, whatever body part, always think about put it where you have solid muscles area, not on the bone area, because then you might not get the perfect connection. So I ask the patient to pick up the arm and put it down. And whatever he does, keep his arm on that. If he is trying to move away during the treatment, it can be kind of slightly burning feeling from this one. It's not dangerous, it's nothing to worry about, but just tell the patients, always keep the arm steady on this return electrode. And we regulate the intensity with the treatment head. Having an epicondylitis, meaning if it's the proximal part that's affected on the epicondyle, it's very often very painful by pinching on it, just pressure and palpating, and some pain through the tendon down to the muscle as well. Treating it, we don't only treat the area where it is attached to the bone, but we also treat in the length of this muscle, like 10 to 15 centimeters. Now I spread out the cream more or less in the area I'm supposed to treat. Okay, then we have to choose the diagnosis on the display. Epicondylitis. We have it up here, and we pinch OK. And then we get the treatment time and the fixed intensity. Then we can regulate the intensity and also start the treatment on the treatment head, which is very easy. Just pinch once time, and you see the green light coming up, means that the machine is activated. You stop it. And so we wait and we put on, and we have already spread the cream of the area we're supposed to treat. And then I start the treatment. I can have a firm contact with my hand here. I can choose just sitting there and not hold him at all. And regularly asking the patient if it's getting too warm or too hot. Here you will very often see that it gets warmer the closer you come to the bone, because the bone area is less circulated and doesn't get rid of the heat as quick as the muscle area. So it will take, he will probably feel the heat coming up most in the bone area before it comes further on in the arm. I also ask the patient, is it not getting too hot, sir?
It's a little bit too warm.
Yeah, we go down one step and we continue, and we work maybe 15-20 seconds more, and then we ask him again, is it too warm, sir?
Yeah, it's still a little warm.
We go down one more step. Here we probably have to go 3 or 4 steps down during the treatment time, due to the bone area is so close to the skin. So it means that we regularly have to ask him if it's not getting too warm. This is a big difference to comparing to treat in a muscle area. Is it too warm, sir?
Oh, it's okay.
It's okay now. And well, maybe it says again it's too warm, we have to go 1 or 2 steps more down, and then all of a sudden it says I almost don't feel anything. Well, then we go 1 step up instead, because you have to play with this back and forth a little bit during the treatment time. Well, saying this treatment now has been finished, we stop And when it stops, it gives a sound on the machine. That is the end of the treatment time. Then we have to clean the area. We take away this solid return electrode, and we also take away the treatment head. Pick up some paper, clean the treatment system with some spiritus to disinfect it. Put it back in the holder. Get some more paper and clean the patient as well. And even the bench if it's some cream on the bench. After that we take some wet paper, wet them with water or spiritus to get rid of the rest of the lubrication and the cream on the surface. And dry it off. You must never forget, by using a Skanlab, is very often one part of the total treatment on the patient. It means that this is one thing we do next to stretching, eccentric exercise, or whatever your choice is and what your experience is to get the optimal result of you treating the patients. But to be becoming a good physical therapist is a question of making a good cocktail. The mix of the electrotherapy, the Skanlab, together with other things you have in your experience. That's a good cocktail and it gives you the quickest results.